A lot of Granite Staters battling winter illnesses right now. Check out the map here. Things like the flu, COVID, RSV. You can see the numbers are considered very high in New Hampshire. That's that dark color we have right there. A lot of you have questions about how to handle this, how to handle your health in these winter months. We are joined live right now by epidemiologist Dr. Gabriela Andujar-Vasquez with Dartmouth Health. Doctor, great to see you. Thanks for joining us. We've gotten so many questions from our viewers. I want to start with one of these. It says, I know that respiratory infections, they want to know if it was more severe this year. They said that they had bronchitis and they thought they knew what to expect, but then they actually broke a rib coughing and then part of their lung collapsed. They said they never would have expected this. So to that end, are we seeing more severe illness with that example?
Yeah, that's a great question. I mean, right now, the main virus we're seeing in our community is influenza. While bronchitis can be because of a variety of viruses, it's possible that this particular viewer experienced a severe form of influenza, which can happen because this virus can cause a spectrum of illness from mild to severe. There's thankfully no indication that the influenza virus that we're seeing circulating in our community is a type that we would consider more severe, to cause more severe illness, or it has mutated in some way or another that would indicate that we would have to be worried about more severe strain, as you would say, than prior years.
And to that end, Dr. Vasquez, we showed the map at the top of this interview here. New Hampshire is listed as one of the states with the highest levels of respiratory illness. One of our viewers wanted to know, why is it so bad in our state this winter, and is there anything that can be done to stop that or lower our levels?
Right, certainly. Yeah, we saw a really quick uptick in our community. Like I would say in the past 2 to 3 weeks, it's just sort of increase quite rapidly, and I think in the next couple of weeks we'll see how things unfold and whether we find a way where it starts plateauing or sort of we see a little more of a trend, since it's very early, or we're now really in the middle of the season. We certainly have a lot of strategies to stop the spread, right? We've learned a lot of this throughout different respiratory illness season, and with COVID-19, one thing is vaccination. We know that we can be vaccinated against the 3 of the major viruses that cause respiratory illness, like RSV, flu, and COVID. And then certainly hand hygiene, washing our hands, staying at home when we're sick or feeling ill from a respiratory illness. Consider masking if we're around others in very close indoor spaces. All those etiquettes around, like covering our cough if we're not really wearing a mask, and testing, getting care if we need it.
And very briefly, speaking of care, we had a viewer ask about Tamiflu. What can you tell us about when folks should be considering getting that?
Yeah, absolutely. So it's certainly an antiviral medication that's one of the many that we do have available for treatment for influenza A and B, which are the 2 major strains. I would certainly consider for you, if you have a lot of chronic medical conditions, or you're really early, if given very early in when you start having symptoms, is the most effective, and it helps you feel better quicker. So certainly if you're feeling like this is not a very common cold, like it feels like it's more severe, I would talk to your provider and talk through of your options around treatment if it will be beneficial for you.
All right, and we're halfway to spring. Dr. Vasquez, thanks so much for joining us.
Of course, thank you.